in, take a seat. How are you doing? Okay. Well, my name is Nurse Sophie. It's lovely to meet you. I believe you're a new patient, aren't you? So you've never met before. Well, it's a pleasure. So when you see a doctor for a longer examination such as this, we like to just save a little bit of time, and you'll be meeting with a nurse such as myself or one of my other colleagues to take some of your vital signs. This is just so we can get patients through with the doctor a little bit quicker, and also as you are a new patient, it's good to have these vital signs on file so that we can compare the years to come. Alright, so I'm going to have a little listen to your lungs first, if you don't mind. So if you could lift your top up for me. Thank you. And I believe you're having a full cranial today. You ever had one of those before? No? Okay. They can be quite fun exams. So, if I just pop this on your chest, okay? And just relax, breathe nice and normally for me. That's really good. Okay, if you can just take a deep breath in and out. Okay, let's do that again. Deep breath in and out. Good, okay. Let's do that one more time. Deep breath in and out. Wonderful. Just give me a second. I just need to make a note. I don't actually have my computer on me at the moment. So I'll be noting everything down on paper for now. Great. Okay, next I want to take your heart rate. I've just got this oximeter. I want you to pop this on your finger. It's just going to take your heart rate, okay? Okay, pop that on there. There we go. Okay. And if we just give this a moment, it might take a few seconds just to take your heart rate, okay? Okay, so we're currently at a blood oxygen level of 98%. That's really good, and your heart rate is currently sitting at 84. Okay, let's write that down. Okie dokie. And let's just quickly take your temperature. Stay nice and still for me. Okay. And then we'll take it in the ear as well. Let's start with this ear. Okay. And we could measure this ear as well. Lovely. 37 on the dot. Right. That's what we like to see. Okay, dokie. Right, I'm just going to take your height and weight. If you could just step on the scales just right next to you. Okay. And then just back up a little. I'm just going to bring this down. Okie doke. So we're 5'7". Okay, great. Moving on, we'll take your blood pressure now. Have you had your blood pressure taken before? Yep, so you know the drill. If you could just roll your sleeve up. Okay, just pop this cover around you here. Okay, that's great. Okay. Okay, let's take that off. Just make a note. Blood pressure. We're currently 112 over 82, so nice and healthy. And let's just finish with an ECG. Okay, we had an ECG before. No? Okay, nothing to be worried about. It's nothing scary, you won't feel it. You could just lift your top up and roll your sleeves up, okay? I just have these little electrodes that I'm going to be attaching to you. And I'm just going to hook you up to the monitor, and it's going to send a very, very low electrical current. And this just checks that your heart is working nice and efficiently. Okay, so we're just taking these little sticky pads here, and we're going to be popping them on your chest like this. Good. Okay, and then on your arms here as well. Okay, just give me a second to get you wired up. This one. 2, 3, and 4. Okay, right. You haven't got any jewellery on? No, any smartwatches? Okay, wonderful. And okay, wonderful. You can relax now. That's all turned off. Let's unplug you here. And let's just remove these little pads for you. Okay. There we go. Right. Just dispose of these. your ECG results have come back absolutely fine as well. Okay, so that's all your vitals taken with me. If you want to go and wait back in the waiting room, and I'm sure the doctor will call you probably in about 2 or 3 minutes. Okay, pleasure to meet you as well. Alright, bye-bye. Hi, Mr. West, is it? Hello, I'm Dr. Michelle, and I'll be conducting your cranial nerve examination today. You've had a cranial nerve exam before? Okay, well, it's going to be quite an extensive examination. I'm going to be looking at your 12 different nerves. Okay, these will be grouped into different groups depending on where I'm looking. So, for example, we have the ocular nerve, which is taking care of our eyes. We also have the olfactory nerve, which is our sense of smell, our cochlear nerve, hearing. Does that make sense? Wonderful. Okay, I'm going to be referring to my notes throughout, if you don't mind, just so I can make sure that we're quite extensive and thorough with the examination. I want to make sure that I don't miss anything off, okay? Wonderful. Alright, so I believe that you're having this cranial nerve because you had quite a significant head trauma, is that correct? Okie dokie. And I know that you mentioned to our receptionist as well that you're concerned that you may have asthma. Right, okay. That's something I can quickly determine now, if you don't mind. I just have this big flowmeter, okay? And all I need you to do, it's thoroughly sterilised. All I need you to do is have a nice hard blow on it, and we'll have a look at your lung capacity, okay? So, blow. Good, okay. You're absolutely fine. You may feel sometimes that you are experiencing asthma-like symptoms due to low cardiovascular health, so what I would definitely suggest is increasing that cardiovascular activity. So going out for walks, or maybe some cardio exercise, so treadmill, cross trainer, maybe going dancing, things like that. Alright, anything to get your heart rate up. Okay, right. So we're going to begin with the optic nerve. This is going to be quite simple in the sense of it's going to be very simple, and like you're going to the opticians. Alright, great. So we begin first. I'm going to be using my light here, and I'm going to be shining it in your eyes, okay? Okie dokie, stay nice and still for me. Are you experiencing any specific head trauma symptoms, feeling dizziness, tiredness, headaches, lack of concentration? Okay, I'm just going to switch between the eyes now. Any problems with our vision that we're experiencing? No? Okay, that's great. So, I'm going to also be looking at your overall facial symmetry, especially your ocular symmetry. So I'm just going to be preparing my hands here because I'm going to be most likely touching your face throughout the examination. So I'm just going to take an antibacterial wipe. Okay, lovely. So let me just have a look at you. I'm going to be assessing how symmetrical your eyes are, as well as the rest of your face as well. This is helping me to determine whether or not you've experienced any stroke symptoms due to the trauma. Okay, I'm happy with that. Let me just make a quick note. Okay, next I want you to keep your head nice and still for me, and using just your eyes, I want you to follow my finger as it travels across the room. Alright, ready? Okay, let's do the same again by covering one eye. Okay, keeping the head nice and still again. Okay, and then covering the other eye instead. Ready? Okay, great. Next, we're going to be doing similar tests. Okay, where I'm going to ask you again to keep your head nice and still. I'm going to be placing my finger in front of my face here, and I want you to focus your eyes on my finger, and then look at my nose, and then look at the wall behind me. Okay, wonderful. Back at my finger, and at the wall, and at my nose. Back at the wall, back at my finger, at the wall, at my finger, at my nose, and at my finger. Great. I just want you to follow my finger, keeping your head still again. Good. Keep following. Good. Okay, dokie. Okay, next we'll be assessing your peripheral vision. So again, pretty similar. Okay. So, keeping your head nice and still again, I'm going to be using my fingers to bring them in to your field of vision, and I want you to tell me when you can see them. Alright? Good. Head nice and still. Very good, okay. Good. Good. Great. Okay. And let's do that with covering one eye. Okay, same again. Head nice and still. Good. That's it, just keep focusing on one point. Good. Good. Okay, great. And then switching to the other eye. Okay, ready? Good. Good. Great. Okie dokie. Alright, so it seems as though your ocular nerve is working efficiently. Let's move on to your facial nerve. So we're going to be assessing the symmetry further. I'm going to be assessing some of the facial muscles and making sure that they're feeling as they should do. Also making sure that you can feel the sensation. We're also going to be doing some facial expressions to make sure that you can use the muscle groups as they're intended to be used. And then we're going to finish with the muscle strength. So I'm going to be asking you to lock your jaw. I'm going to be using some force. Okay, great. So let's start with the facial muscles. I'm going to give you a few facial expressions to pull, and I want you to just pull them when I tell you to. Okay, so first, if you could pull out your cheeks for me. Okay, I'm just going to have a feel. Just palpating the muscles as you're using them around the jaw and the cheeks. Okay, relax. Good, and then a big, nice smile. Good, hold that. Lovely. Okay, and then could you frown for me? Okay, and then stick out your tongue. Move your tongue to this side, that side, up to the roof of your mouth, and down again. Okie dokie. And could you pull a sad face? And finally, open your mouth as big as you can. And then make it as small as you can. Great. Okay. Okay, next we're going to be assessing the muscle strength. So I'm going to be asking you to push against my hands. So I'm going to place my hand here and I want you to try and push down. Good. And then next on this side, try to push my hand. Good. This side, push. Okay. And then keep your head up. Keep your head up. Good. Okay. While we're here, we'll do some hand assessments of strength and muscle as well. So if you could squeeze my hands as tight as you can. Good. And now I want you to push. Push, 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 push. Good. And in between, I want you to push. Good. And then don't let me close your hands. Push, push, push. Good. And shoulders, lift them as high as you can. Good. Okie dokie. That's great. Okay, we'll move on to touch, sensation and symmetry. I'm going to be having a little look at your face now and just assessing the overall symmetry, okay? So just stay nice and still. This will just take a little minute. Just going to be having a look. Okay, just keep your face nice and relaxed. turn this way and that way. Okay. Great. Finally, I want you to close your eyes for me. I'm going to gently press on your face and I want you to tell me where it is that I'm touching, okay? Okay, close those eyes for me. Good. 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 Okay. Great. Okay, I'm happy with that assessment. We'll quickly move on to your sense of taste, seeing as this is a quite quick one. Have you noticed any changes in your sense of taste? Okay, great, and I'm going to do a quick gag reflex test. I hope you don't mind. This is the worst part of the examination. Just take a nice clean tool here. Okay, so nice clean lollipop stick. If you could stick your tongue out and open your mouth. Good. And okay, let's try that again. Great. Okie doke. And just keep that mouth open for me. I'm just going to have a nice little look. Just to look at the symmetry inside your mouth. And we forget quite commonly that the tongue is also a muscle that can lose its symmetry when trauma is applied. Okay, I'm happy with that. Wonderful. Okay, right, we'll move on to your olfactory nerve. So I'm going to be testing your sense of smell. Okay, I have these little vials here, all non-labelled, so you'll be able to know what scent is in them. And I'm just going to simply waft them in front of your nose. And I want you to tell me what you can smell. Okay. Okay, first one. What can you smell? Lemon, very good. Okay, great. Next. Ready? Okay. What can you smell? Grass? Very good. Okay. Just two more. Okay, next one. Okay. What can you smell? Cherry. Very good. Okay. And let's grab the last one here. Okay. What does that smell like? Peppermint. Very good. Great. Nice, quick and easy one. Let's just make a note and you pass that one with flying colours. Okay, and our final is our cochlear nerve, so we are going to be doing a number of hearing assessments, okay? Have you ever had a hearing test before? Right, so I'm going to be doing 3 separate tests. One to do with word understanding, so I'm going to be whispering a few different words from ear to ear, and I want you to relay that to me, okay? Next is distance sound, so I'm going to be making a flutter sound like this, and it's going to get further away, and I want you to tell me when you can stop hearing it. And we're also going to be making this sound again, left to right, so that you can assess which direction sound is coming from. And then finally we have this tuning fork, and I'm going to be doing similar testing with that, so directional and distance. Okay, wonderful. So we're going to begin with the word interpretation, okay? I'm going to begin with this ear here, and I'm just going to go into a whisper here. I'm going to be whispering different words, okay? Alright, and just repeat them back to me. Ready? Box. Okay. Candle. Good. Garden. Very good. T-shirt. Okay. Temperature. Okay. Apple. Good. Bird. Okay. And chest. Okay, very good. I'm going to be moving on to the other ear now. Okay, I'm going to whisper again. Feather. Okay. Disc. Good. Pin. Good. Pillow. Good. Flower. Good. River. Okay. Desk. Good. Flight. Good. Cloud. Good. Okay, very good. You just make a note. We're flying through these. Okie doke, let's move on to our distance. So this is perfectly okay for you to keep your eyes open for now. I'm going to be making this flutter noise, and I want you to just simply tell me when you can't hear it anymore. Okay, ready? Good. Okay, and again. Good. One more time. Very good. Okay. Okay. Now I want you to close your eyes. I'm making that sound from ear to ear, and I want you to tell me whether it is your right or your left that you can hear the noise. Ready? Okay. Good. 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 Okay. Good. Okay. Okay. Very good. Alright. Okay. And finally we're going to be moving on to the tuning fork, okay? So I want you to close your eyes for me, okay? Good, and I'm going to be playing the tuning fork, and I want you to tell me when you can no longer hear the sound. Alright. Very good, okay, and again. Very good. Okay, I am satisfied with all of those tests. Now, I know you were referred by the Accident and Emergency Department to come for the cranial nerve due to head trauma. I am satisfied to say that you have passed that, so I'm not concerned that the head trauma has had any lasting effect. However, I would suggest that you definitely keep an eye on yourself. Please take a lot of rest and maybe give yourself 1 to 2 weeks of pure rest off of work as well, okay? Just because we don't want to exacerbate anything. If you are feeling any pain, please take paracetamol, but don't take ibuprofen just because that can reduce any swelling. And if there is swelling present, we want to know about it, okay? And otherwise, you can report to reception and book in for your next appointment. Alright, thank you. Bye bye now.